Rotator cuff is located between acromion and humerus. Acromion grows and space becomes narrow. Rotator cuff muscle is crunched between these two bones and it's called impingement syndrome. Superficial to rotator cuff is called subacromial bursa. Arm elevation results in subacromial bursitis and rotator cuff tear. To check impingement syndrome, fix shoulder with one arm and elevate elbow to create pain. Elbow is turned in front and rotated to aggravate impingement. Rotator cuff is torn with repeated impingement. Complete rotator cuff tear may result in disability to raise arm, which requires surgery. Arthroscopic rotator cuff repair is regenerative surgery that restores function of shoulder. With time, tear becomes greater and muscle is retracted and turned into fat, so it becomes irreparable. Acromioplasty is removal surgery of acromial spur. Rotator cuff tear patient cannot raise arm, but when arm is pulled above shoulder level with help, one can elevate arm. Patient can slowly lower arm from the top, but shoulder suddenly drops at the level of shoulder joint. Shoulder drop caused by cervical disc herniation is little different. Patient cannot elevate arm in any position.